Hi, my name is Brian Tarpey. I'm here with Joe Lazzarati from Jackson Lewis, a partner with Jackson Lewis in their ERISA area. Joe, a lot of our clients right now are dealing with their concerns about healthcare reform. Can you give us an idea of what they need to be concerned about in 2011?
Sure. Healthcare reform is, I think, giving a lot of people a headache, and especially this open enrollment. This is the first open enrollment that calendar year plans are going through, and I'd probably say there are four things that I would focus on. The first thing is obviously open enrollment, getting the notices ready, communicating with employees. Employees can have a lot of questions about various things. And that kind of leads into the second thing, which is the notices. There are some specific notices that employers are going to have to issue to employees. For example, under the healthcare reform, you have to cover dependents to age 26. And those dependents are essentially entitled to a special enrollment right, if you will. The notices have to go out no later than the first day of the plan year. That begins after September 23rd, so for calendar year plans, that's January 1st, 2011. And that notice basically tells the employee they can enroll the child if someone is aged off or they're on COBRA because they passed age 20, they passed the age under the plan where they're no longer covered. The other notice is a notice of people who might have gotten off the plan because they reached a lifetime maximum benefit, and so they can get back on if they want because there's no longer going to be lifetime maximums under the plan. The third thing that employers should be thinking about is their plan grandfathered? Probably at this point in time, employers should have been thinking about this already, but it will determine whether you're grandfathered or not, whether certain provisions apply to your plan or not. And then the last thing is going through and implementing it, all these changes, and thinking about what comes next, because healthcare reform has created a number of changes that take place over the next 4 years. And it's important for employers not to get lax into thinking that, well, let's wait till next year. There's things they should be looking at, things they should be changing in their plan documents to prepare for what changes come ahead in healthcare reform.
Great. Thanks, Joe.